So I would like to thank the ELF for organizing this virtual patient day and for giving me the opportunity to speak about some of the issues that have been concerning us during the ongoing COVID crisis. Let me start with a quick introduction of myself and the points that I want to raise. My name is Susie Shanks, and I'm a committee member for the PCD Support Group in the UK and in Scotland, and I'm also a member of the German PCD group. My younger daughter, Julia, who you see in some of these slides, she is now 12, and she has primary ciliary dyskinesia, which is a rare genetic condition with a spectrum of symptoms, but mainly impacting on respiratory issues due to the cilia not working well or not at all. So you see a couple of photos there of her being born, her doing her nebulizer as part of her physio. That's daily routine, whether we go on holiday or not. And the middle slide shows her representing the PCD Support Group Scotland at a reception for the Rare Disease Day at the Parliament in Edinburgh. My talk is titled Support Provided to PCD Patients and Families During the COVID-19 Pandemic and Challenges Faced. And I will briefly talk about the work of our support groups in general, and then more specifically about the current changes, the differences faced by the devolved nations in the UK, and some conclusions for ongoing and coming work. Julia was diagnosed with PCD after a wait of over 2.5 years, and that was in 2013. And while the treatment that had been suggested during that period of waiting didn't change much after diagnosis, the links that we established within the PCD community made a huge impact of how we have come to live and care for a child with a chronic condition. For a few years, I have been part of the UK PCD committee, and I'm also a founder member of the PCD group in Scotland. There are 4 PCD centres in England, but no specific care so far in any of the devolved nations. Recently, a bid has been submitted for a diagnostic paediatric service to be established at Glasgow's Children's Hospital, which would be a basis to change the care of first children, but hopefully soon also adult patients with PCD. There's also work on genetic testing for PCD at the MRC in Edinburgh. Since setting up the Scottish group, we have had opportunities to attend events at the MRC in Edinburgh, at various hospitals in Scotland, and have also participated in many rare disease events, and those organized and hosted by Genetic Alliance. You can see on that slide some of these groups mentioned. We are also part of the cross-party groups at the Scottish Parliament for rare genetic and undiagnosed conditions, and also the cross-party group on lung health. And I am a member of the Patient Advisory Group for Rare Conditions at Glasgow's Children's Hospital. We have so far held 3 PCD days in Glasgow, where patients and families come together and have the chance to meet each other and to listen to and engage with specialists on various aspects of research, clinical issues, daily matters, health and well-being. These have been in addition to the annual PCD Day organized by the UK group, and there have also been a couple of Northern PCD Days. We have been discussing how to coordinate these events in future, but somehow the current restrictions have taken the decision away from us for the time being. The shift from real to virtual events has been working for us well so far. Many of our patients have to be careful to avoid infections, and infection control is always a big issue for us individually and of course collectively when meeting up. There is no comparable data on the spread of passing on infections that could lead to similar restrictions as known from cystic fibrosis patients, but we have been wondering about the pros and cons of meeting in person. Until the outbreak of COVID-19, we have been issuing hygiene guidelines to all attendees of PCD days, warning not to attend if sputum has recently tested positive, to follow good hand hygiene, and have supplied hand sanitizers and tissues. When attending PCD weekends organized by the German PCD group in youth hostels, further advice was given in regard to sharing and using toilets, with the option to use individual ones in the hostel rooms, but also for sharing food and eating in communal areas. Having had our first virtual UK PCD Day this June, we have found it to be a lot more inclusive for members, for those who were experiencing infections or those who fear to pick up infections, but also considering economical aspects, like travel costs, overnight stays, the costs of the group for hosting it, the venue has to be paid for the food organized and paid for speakers' expenses, again, travel costs. Admittedly, I do not know what the situation would have been like if the structures and network within the group had not been established earlier by having been able to hold real events in the past. An example for this were recent changes within the UK committee, which showed a combination of virtual interactions and some normal meetings. In April 2019, a long-term goal of the group had been fulfilled by the granting of funds to extend the paediatric services at the 4 NHS centres in England to include adult care. Having passed this milestone, the goals and objectives of the group were debated, which happened with the input of all committee members on a draft paper that was then debated at a workshop-like session in October 2019 in London, attended by most committee members and by professionals who are involved in the PCD care. The changes and implementations have enabled us to continue with online meetings, Zoom meetings, communicate by email or WhatsApp correspondence. Our Scottish group is less structured, and we are currently just able to react to events and share information online. But because we're linked to the UK group, we are able to benefit from their links and expertise. We are planning to reach out to Wales and Northern Ireland, but find it difficult to initiate the contacts without a common starting point in the form of a PCD awareness event or PCD day or similar. In Northern England, occasional PCD days have led to some contact between patients and also between patients and clinicians. But the fact that there are PCD centres in Leeds, Bradford and in Manchester compensate for the lack of a regional group for patient support. One aim of the support group is to ensure that patients can access information more easily and safely, which is an important aspect in the current situation that is constantly evolving and changing. As a charity, we always have to be aware of the diversity of medical opinions and make sure that patients have enough general information to pursue individual aspects of their conditions. At the beginning of the COVID-19 pandemic, we had the added problem of having little official information. For instance, the guidance from the UK government, as well as from the devolved governments. While it is now normal to differentiate between the different nations and sometimes even regions of the UK, it was initially seen as a political point scoring, for instance, when Scotland announced the closure of schools before the UK government did. Early on, it was difficult not to interfere with official guidelines for giving personal opinions on our support group websites. In the meantime, a patient-led Facebook group has been started, which does not have to follow these considerations and makes it easier to state opinions, while the official recommendations and guidelines can still be found on the official group pages, and they are monitored by dedicated committee members. In addition to our virtual PCD day, we were able to host an online question and answer session with various PCD experts in May 2020, specifically on the implications of COVID-19 on PCD patients, which we could then also post on our website alongside the recordings of the PCD day. This means that even for people who struggle with technology to access these virtual sessions, as long as they have internet access at some point, the information is there to be called upon, which makes it again more inclusive than just attending a real event. We are now considering running various online sessions with different aspects to focus on, for instance, for different patient groups, for adult patients, teenagers, parents of children with PCD, and also events with different points of emphasis, for instance, on work or school, on mental health, virtual appointments, research. The group has also applied for grants to update the website and to make it more accessible. This would also benefit clinicians to coordinate the flow of information between the consultants and patients, but also in regard to government advice, health board advice, which is particularly important in response to the corona crisis. There have been a range of communication, of ways of communication, and we were able to share information amongst each other, but that depended on individual feedback of either committee members and then deciding to post and share official information, or group members in social media pages that were not part of the official group. However, the latter always bears the risk of spreading rumors or information that is not meant for general advice, and therefore having structures in place that can be accessed by professionals via the support group seems to be a much more sensible approach. To give an example, the advice on shielding was sent out by the Scottish Government, but there were also letters sent out by PCD consultants. While adult patients received these letters first, pediatric patients had to wait a few weeks longer, and while it did not matter on a daily basis whether a letter was received or not, it showed that the system of communication was working or not working. Different GP practices also advised differently to enable this kind of communication. While some encouraged the patients to contact them when they thought they should have got the letter, others actively discouraged them. Similarly, the support to those shielding was different in each of the devolved nations. While some had to opt out of food supplies, others had to opt in. But in general, once a system of communication had been established, in Scotland, for instance, there's also the option of receiving text messages, it seemed to have worked well. Coming out of shielding seems again to be causing confusion amongst patients in different parts of the UK, which is more related to a general lack of coordination due to political structures than something specific to medical health boards. It is not on me to judge these structures within the UK, but from the media coverage, I get the impression that a federal system like the German one shows different structures that can enable a country to coordinate decisions taken on a federal as well as a national level. In conclusion, COVID-19 has shown that having clear lines of communication between a support group and patients, as well as between clinical centres and support groups, helps the flow of information, which is essential in the response to current evolving situation. The more established these links are, the easier it is to maintain them virtually. My last slide just shows some of the links that you might need in order to get in touch with us. And that's something we always encourage and would appreciate. And any feedback that helps us as a support group or that can reach out to other support groups is always something that is our intention. Thank you very much for listening.